Hi everyone, it's time for Pose of the Week. This is Dr. Ginger Garner. We are going to look at improving T9 to T12 rotation and some higher segmental rotation because a lot of times we feel stuck rotating one way or the other. So in this particular case, we have learned that there's a lack of left rotation in the lower mid spine or thoracic spine. There are lots of different ways you can approach this. This is one of the higher level ways you can approach it if you have really good body awareness and you love doing yoga. So here we go. We're going to start in mountain, and I'm just monitoring her alignment all the way through. In mountain, she'll line her feet up. Line that foot up. There we go. Okay, and then as she comes into chair, and we've been working on this for months, so she gets how to come into chair and then do her hip lock. If you have not seen the locks video, I encourage you to do that first. Because we've been working on down training what's in the front and up training what's in the back, she's going to check and make sure that her hip flexors, her psoas, and her other hip flexors are not being snarky. I'm going to look at alignment here because we have a tendency to lateral shift and shorten this side. So she's having some back pain and hip pain here, okay? Then she's gonna lunge her right foot back to a warrior one pose. And she's just gonna gas pedal up and down through that back knee because it's early, right? The calf is gonna be tight. And there's also a tendency, if she looks in the mirror, to be thrust forward in the pose and to go into an anterior tilt. So we want her to come out of that anterior tilt, which means she's in a nice spinal neutral and she's controlling it. She's gas pedaling to kind of loosen up and heat up the back leg for what we're about to do, which is revolved triangle. It's a tough pose. Once she feels like the back leg is warmed up, then she can ground that heel and she will bend the front knee and then begin to hinge from the hip, not bend at the spine. So no bending at the spine. And I am in this position, one, to keep her from falling over, because I'm asking her to do a lot at one time, and also to look at her spinal alignment. As she goes ahead and folds, we want her to fold from the hip, not the spine, and I'm going to make sure she doesn't laterally shift. You can keep going up and back. Good. That she's not laterally shifting and that she's not bringing this hip forward. So she'll check by looking in the mirror and drawing that left hip back. Because our tendency is to, if you want to demonstrate for a second, let the left hip go. Yeah. So she lets the left hip go and she folds. She's just shortening and giving in to the tightness that's in the left side of the low back. But we're going to bring the left hip back and then she's going to fold. Good. And she's doing a great job of self-correcting. And what I mean by that is I'll show you. Here, if I'm here and shortening, the hip goes forward and I shift over to come into that forward bent position. We don't want that. We want to keep ourselves square here. And you can do that by bringing your thumbs back to your, what's called your PSIS, the little divots in your back. So bring them back to here. Find the divots, make sure that this left hip stays back and square, this stays level, and then you fold. Right? So now she's ready because she's warmed up. She's going to fold at the hip. So a hip hinge, hip hinge. I'm going to correct that lateral shift a little bit, keep her from falling over. She's going to bring her right hand down to the ground. Good. I have my leg on her outside right leg so she doesn't fall over. I'm going to create a little bit of length right here. I'm going to go to the T9, T12 segments where she's having trouble, and she's going to go into revolved triangle, and I'm going to isolate that with a little mobilization. I'm keeping this hip back and lengthening it. You're doing okay?
Yeah.
Good. So my left arm is drawing back on the left hip. My right leg is helping her right hip. I'm going to bring down just a little bit here. Now go back into the rotation if it's okay. Here. Good. So I'm going to curl up the waist and facilitate that rotation where she needs it. When we first started doing this, you were not getting that far, right? She's already really improved her rotation. And then go ahead and come out of it. and then hinge to come back up. So good. All right, how did that feel? Great, awesome. So that is one way that you can, if you're having tightness in what's called the quadratus, tightness in the low back, tightness in the rib cage, tightness through the front of the hip, revolved triangle is one of the ways that you can begin to target it. Of course, it helps if you have your friendly physical therapist there to manually adjust you and mobilize you as you move through it, which is one of the big tenets of medical therapeutic yoga, is combining that physical therapy and rehabilitation, and sometimes OT as well, with yoga to make it more effective than just yoga alone, or for example, just PT alone. I hope this has helped, and until next time, see ya.